My name is Yvonne Gonzalez, and I will be covering Gehart Chapter 12, Solution-Based Approaches. What is it? Solution-based counseling is a practical theory that maintains a positive, upbeat, future-focused, and active approach. Solution-based counseling should help clients take small, consistent steps toward achieving a solution. There are currently 3 types of solution-based therapies. First, solution-focused brief therapy, which emphasizes focusing on the future rather than the presenting problem or past. The second is solution-oriented therapy, which is similar to solution-focused brief therapy, but adds language-based techniques and interventions that draw from the past and present to develop a solution. Lastly is the solution-focused school counseling, which works with students, teachers, staff, and administration on an individual level to improve student performance and behavior. Some fast facts. Solution-based counseling evolved from systemic family counseling, the work of the Mental Research Institution, and Milton Erickson's brief therapy and trance work. It places the responsibility of identifying solutions on the client, while the counselor indirectly and subtly guides but does not suggest logical solutions. The therapy spends less time discussing the problems and strives to maintain focus on developing a solution. However, the counselor should follow the lead of the clients in determining how often the problem needs to be discussed. Solution-based counselors don't consider the expression of emotions to be curative, but instead view emotions as having idiosyncratic meaning that provides clues to a solution. Some of the approach tools include scaling questions and miracle scales. These tools are considered to be some of the most versatile and comprehensive interventions because they are capable of assessing strengths and solutions, assists with goal setting, designs homework tasks, can measure progress, and manage crisis with safety plans. Techniques to building counselor-client relationship includes establishing hope and optimism early in the therapy to develop motivation and momentum, utilizing past tense, partial, and perception channeling language strategies to emphasize the limited, define the problem in more solvable ways, and engender hope. Past tense language refers to reflecting statements back to clients in the past tense. For example, you were feeling down yesterday. Partial language refers to describing things as partial or periodic. An example question would sound like this: a part of you thinks things will never get better. Lastly, perception language refers to reflecting sentiments as perceptions. For example, right now it seems to you that things will never get better. Another technique used is the beginner's mind, which refers to listening to each client's story as if you were listening for the first time, not filling blanks with personal or professional knowledge. Experienced counselors understand that each client experience is unique and one of a kind. Additionally, echoing clients' key words or words of choice is another effective technique that is used to make the problem seem more solvable and engenders greater hope. Case conceptualization. Solution-based counseling involves conceptualizing where to go from here, which is seen as the solution, rather than where the client has been, which is considered the problem. 2 key concepts to case conceptualizations are: 1, don't dwell on the past, reflect on it but don't dwell. 2, the solution may not be related to the problem, so remain open to possibilities. Getting the client away from the problem and towards a future-focused solution. Use the miracle and other solution-generating questions to help clients envision a future without the problem, generating hope, motivation, and goals. Miracle questions should be used cautiously and delivered subtly. To properly deliver the miracle question, a counselor should 1, prepare clients by changing their mindset. You can do this by asking if they will be willing to play along with a somewhat unusual question. 2. Tailor the question to the client by adding details from the client's everyday life. This will help them become more engaged. 3. Look for visual or other cues that indicate the client is envisioning the setup before delivering the miracle question. 4. Deliver the miracle question. An example of a miracle question would sound something like this. Imagine I had a time machine that would propel you into the future to the point in time when the problems you came to see me for are totally resolved. Imagine you stepped in. Where do you end up? Who is with you? What is happening? How is your life different? How did your problems go away? 5. After the miracle question is asked, the counselor should help the client focus on things done in the response that could lead to an attainable goal in the client's reality. 6. The process should continue until there is enough to identify clear goals. The solution-based counselor should possess the ability to identify expectations to problems, assess previous solutions, and provide examples of what worked for the client in the past. Identifying seemingly minor exceptions could actually provide clues to what works or what doesn't work for the client and help develop goals, which ultimately leads to a solution. Examples of exception questions are there any times when the problem is less likely to occur or be less severe? Are there any people who seem to make things easier? Are there places or times when the problem is not as bad? Additionally, solution-based counselors should assess the client's strength. Strengths include self-esteem, family support, positive relationships, and religious faith. Strengths can be identified by directly asking the client or by listening to the client's response to exception questions. Another aspect the counselor should be aware of is the client's motivation for completing therapy and how they should proceed with therapy. Client motivation can be separated into 3 categories. The first, visitor-type relationships, where a client is referred to counseling by a third party and only participated to get them off their backs. Examples of third parties are court mandates, parents, and spouses, just to name a few. Remember what Dr. Schoen always recommends: never work harder than the client. In visitor-type relationships, it is most likely that the client is unwilling to take action towards change simply because they may not perceive a problem to be present. Because of that, the only motivation is finish as quickly as possible. The counselor should honor this and quickly identify goals that would help them achieve this end. The second category for client motivation or in client motivation is complainant-type relationships, where the client can identify a problem but expects the counselor to provide the solutions for them. These are probably the most difficult types because the counselor will need to come up with ways to help the client identify small ways they can positively affect the solution. The last type of client motivation is customer-type relationships, where the client is motivated to take action towards making a change and willingly collaborates with the counselor to identify both the problem and a solution. These are probably the most ideal type of relationships. Lastly, counselors should assign homework tasks that require clients to take small, concrete steps toward their desired goal. Treatment plan. The treatment plan can be separated into 3 parts: the initial phase counseling tasks, the working phase of treatment, and the closing phase of treatment. Remember, the solution-based treatment plans will set goals that begin with increase in order to maintain the upbeat and positive therapy. Counseling tasks in the initial phase include 1. Developing the counseling relationship. This can be done by identifying strengths, resources, and channeling language to build rapport. 2. Assess individual, systemic, and cultural dynamics by utilizing assessment strategies such as the miracle and exception questions. And 3, develop goals that manage crisis issues and/or reduce distressing symptoms. This can be done by generating step-by-step plans using scaling questions techniques, identifying support resources, and identifying what is working well at the moment to generate hope. Counseling techniques in the working phase include 1, monitoring the counseling relationship and adjusting the alliance based on the client's level of motivation, and 2, increase the exception, miracle, and what works questions to reduce maladaptive symptoms. And finally, counseling tasks in the closing phase include 1, increasing confidence and solidifying new identity by providing compliments and encouragements when a client accomplishes a set goal. 2, use scaling questions to reflect on progress. And 3, increase new skills obtained to build solutions. Working with diverse populations. According to Gehart, solution-based therapy can be adapted to a wide range of populations and cultural systems. It has been used in different contexts such as schools, prisons, hospitals, businesses, and colleges. A 2000 study done by Korokan found that solution-based therapy is a good fit for diverse populations because behavior is considered in context. I'm going to start all over on that one. Sorry. Okay, a study done by Korokan found that solution-based therapy is a good fit for diverse populations because behavior is considered in context. Clients generate their behavioral goals. The focus is placed on behavior rather than emotions. And lastly, it emphasizes solving problems in the future rather than understanding the past. Research and the evidence-based findings. Clinical trial studies found that solution-based brief therapy has effective comparable outcomes to that of other approaches, but is usually done in shorter amount of time, which equates to being cost-effective. Solution-based therapy was also recognized as a promising evidence-based practice by the Office of Juvenile Justice and Delinquency Prevention, and this approach has also proven to be effective in a wide range of populations and problems such as domestic violence, couples therapy, schizophrenia, child abuse, troubled youth, school settings, parenting, alcohol, and foster care. Solution-based techniques such as the scaling questions, miracle question, and first session tasks were found to accomplish their intended therapeutic effect, as well as instilling hope and optimism in clients. Lastly, microanalysis research shows that solution-based therapists are significantly more positive in their formulations and questions when compared with other client-centered and cognitive behavioral therapies. And that's all that I have for you guys. So thank you.